Awesome. So we are ready for the third heat of the day. And for that, we have VAPS, that is the British Association of Pediatric Surgery, and that it's include for the first time this year. So we are glad to have them. And we have UPSA, the European Pediatric Surgeons Association, and PAPS. So let's start with the first one that's from UPSA, Dr. Mina Yeganeh, representing UPSA with lipid nanoparticle delivery of microRNA attenuates intestinal inflammation during an experiment. So let's hear it.
Hi everyone, my name is Mina. I'm a master's student in Dr. Agostino Piro's lab at St. Kitts Hospital in Toronto. Thank you for this opportunity to present our work here today regarding a nucleic acid-based approach for the treatment of experimental necrotizing enterocolitis. To start off, necrotizing enterocolitis, or NEC, is a devastating gastrointestinal disease in neonates. It starts with severe intestinal inflammation, which can lead to intestinal necrosis and perforation, and ultimately multi-system organ failure. Now, in previous years, our lab has shown that administration of human milk extracellular vesicles, or EVs, protects mice from developing NEC. As you can see here on the right, mice that received milk EVs in blue had significantly lower intestinal injury scores as well as lower intestinal inflammation compared to untreated NEC. Despite these protective effects, the underlying mechanisms of milk EVs remain unclear, preventing their clinical translation. Therefore, we wanted to look at factors within milk EVs that contribute to these protective effects. And we found that microRNA 148A, which is the most abundant microRNA in milk EVs, has shown to reduce the inflammatory response in other disease models. This anti-inflammatory effect of miR-148A is mainly known to be through the inhibition of toll-like receptor 4 or TLR4 pathway. TLR4 is a pattern recognition receptor that is critical for the initiation of a pro-inflammatory response. And a lot of the work from Dr. David Hackham's group has shown that TLR4 signaling is actually required for the development of experimental NEC. Therefore, the inhibition of this pathway offers opportunities for therapeutic intervention in NEC. The aim of this study was therefore to investigate the potential therapeutic role of microRNA 148A in the intestine during experimental NEC. And we used a well-established mouse model of NEC, where NEC is induced from postnatal day 5 or P5 to P9 by gavage feeding of 5 osmolar formula, lipopolysaccharide, as well as exposure to intermittent hypoxia. And on days 6 and 7, we administered either miRNA 148A or a TLR4 silencing RNA antagonist, which acts as a positive control in our studies, and both of these nucleic acids were given by enema. To deliver these nucleic acids to the intestine, we employed a lipid nanoparticle or LNP delivery system. These LNPs encapsulate the nucleic acids and release them inside the cells in a pH-responsive manner. We first administered the LNPs in healthy pups through enema, and after a couple hours, miR-148A, which was fluorescently tagged, was present in the cytosol of the intestinal epithelial cells, indicated here by the green signal. This is showing that the LNPs successfully delivered the nucleic acids to the intestinal epithelium in these neonatal mouse. We then administered microRNA 148A and the TLR4 siRNA antagonist in the experimental NEC model. You can see that NEC results in a significantly higher injury rate compared to the control mice, and the administration of microRNA 148A and the TLR4 siRNA both significantly reduced this injury. Next, we looked at the expression of pro-inflammatory cytokines TNF-alpha and IL-6 in the intestine. Again, as expected, you can see a significant increase in the gene expression of these pro-inflammatory cytokines during NEC compared to the control mice, while the administration of miR-148A and the TLR4 antagonist both result in significantly lower inflammation in the intestine. And lastly, we used a reporter cell line that allows us to measure the activity of NF-kappa B, which is a transcription factor downstream of TLR4. And you can see that the control cells in green showed very little NF-kappa B activity on the y-axis. When we administered lipopolysaccharide or LPS, it activates the toll-like receptor pathway, and we see a significant rise in NF-kappa B expression in red. We then administered LPS plus either miR-148A or the TLR4 antagonist at 2 different concentrations. And you can see that these nucleic acids both significantly lower the NF-kappa B expression at both concentrations. In conclusion, we have shown that the lipid nanoparticles successfully deliver the miR-148A to the distal ileum of neonatal mice, and during experimental NEC, administration of miR-148A results in reduced intestinal injury and inflammation, and this is mainly through the downregulation of NF-kappa B signaling. And with that, I'd like to thank the PRO Lab for their constant support, and thank you for listening. I'd be happy to take any questions.
Awesome. Well, Dr. Yeganeh, thank you for this presentation. I really enjoy it. I have only one question, is that if this microRNA can only palliate the injury, or can we treat NEC in a preventive way?
That's a great question. Thank you. It's really hard to distinguish between preventative and therapeutic interventions with the experimental model that we have right now for NEC. It's a very short model. It starts from P5 to P9, and we see the surge in intestinal injury and inflammation around P6. So it starts and it sort of increases from P6 to P7, and that's when we try to have our therapeutic intervention in that sort of time span to sort of count as a therapeutic measure. But if you want to start earlier on, P5, it would be acting as a preventative measure. So right now in this study, we looked at it as a therapeutic approach, but it's very difficult to distinguish between those two with the current model.
Awesome. Thank you. Thank you very much. Let's see, then if we have some questions in the chat, you can always answer from there. And
sure. Thank you so much.
Thank you.
Thank you so much. Great work.